Acupuncture treatment of P syndrome using the distal points. In general, the acupuncture treatment of painful obstruction syndrome is based on the choice of points from 5 possible groups: distal points, local points, including Ashi points, adjacent points, points according to pattern, general points. Distal points are the points below elbows and knees that can treat problems further up along the channel. One or more of these points must always be used to treat painful obstruction syndrome. Distal points open the channel, eliminate stagnation of qi, and help to expel pathogenic factors. They are used with reducing method in acute cases and even method in chronic cases. Distal points are chosen according to the channel and area involved. It is important to make this distinction. One should first carefully evaluate which channel is affected and then select the appropriate distal point according to area affected. Each distal point affects a particular area more than another. This is partly in accordance with general principles and partly empirical. For example, to treat a shoulder pain along the large intestine channel, most large intestine points between the elbow and fingers may be applicable. However, some have more of an affinity for the shoulder, and those are the ones that will be selected. As a general principle, the more distal along a channel a point is, the further up along the channel it extends its influence. For example, the point GB34 affects the shoulder joint, while the point GB39 affects the neck. Of course, this is not an absolute rule, as it has many exceptions. For example, the point GB41, which is below the point GB39, and should therefore affect an area above the neck, can affect the hip and breast. Since the distal points are by definition those below elbows and knees, it follows that in the case of wrists, fingers, ankles, and toes, there are no distal points, with few exceptions. Or to put it differently, in these cases, the distal and local points coincide. Distal points do not always need to be chosen from the affected channel, as distal points on one channel can affect another. This particularly applies to channels of the same polarity on upper and lower limb, and especially the yang ones. Greater yang, small intestine and bladder; lesser yang, triple burner and gallbladder; and bright yang, large intestine and stomach, which connect in the face area directly. This connection opens up possibilities in terms of treatment, as distal points can be chosen not only on the affected channel, but also on its related channel of the same polarity and opposite potential. For example, large intestine and stomach within the bright yang path system. Channels of opposite potential are one in the arm, the other in the leg. For example, LI and stomach within the bright yang. For instance, a point on the LI channel, such as LI4, can treat stomach channel problems on the face; vice versa, stomach 44 can function as a distal point for problems in the LI channel in the face. Distal points of related yang channels can also be chosen according to the correspondence of joints in the upper and lower limbs: shoulder, hip, elbow, knee, wrist, ankle. For example, if tenderness and swelling appear in the wrist along the triple burner channel, one can use a distal point on the channel of the same polarity, in this case yang, an opposite potential, that is, of the leg in this case, the gallbladder channel. Because of the correspondence between wrist and ankle, the point will be GB40. So we have here the distal points also for painful obstruction syndrome according to area. For the neck, we have GB39, SI3, SI1, TB5, TB8, and bladder 60. For the shoulder, the distal points are TB5, TB1, lung 7, LI4, LI1, stomach 38, bladder 58. For the lower back, we have bladder 40, 60, 59, and 62. For the sacrum, we have bladder 40 and 58. For the elbow, LI4, 1, TB5. For the hip, GB41, and bladder 62. For the wrist, we have stomach 36, spleen 5, GB40. For the knee, we have spleen 5, SI5. And for the toes, we have LI4. Thank you for your attention.